So let us begin with two interesting remedies from the Allen's keynotes. We have discussed in the last session something about the entire magnet affecting the human body and the emotions and the sensations. It is very difficult to come across this remedy as a prescription because we are engrossed in, uh, you know, prescribing polycrest remedies, calcarea, phosphorus, arsenic, sepia, natramure. But there will be some patients and some sensations and some symptoms which will always and always tend you to think about something else. It can be the entire presentation of the patient, it can be one symptom of the patient, it can be physical general of the patient, or it can be the pathology of the patient. Whatever be the case, you need to know each dimension of each remedy and all the arms and ammunitions that you will be using towards the disease. And that is what the magnet as a remedy uh, works. And in the last session, we saw that magnet as a remedy influences various sensations in the body. It affects a lot of problems at the level of physical sensations and something that is eccentric. So glad to see some few people on Instagram joining and also on YouTube on the live. We are live simultaneously on Instagram and YouTube. And Dr. Samuel Kumar, Prince Gupta, Dr. Rux, glad to see you all. And this is one of the sessions of Alan's keynotes, which has been continuing since the last 3-4 months, which I'm doing on a regular basis, on everyday basis almost, barring a few days sometimes. But the continuity of the study should go on, and it will continue with the next few books also, which are important for a beginner or a professional homeopath to prescribe, and with the help of clinical cases which I saw or maybe I read or I experienced by attending any seminar or seeing any cure case or reading any cure case. So we are discussing the remedy, which is magnetis polus articus and magnetis polus australis. For a beginner or for a person who has not read these remedies, the names will seem very much alien. And there is a request from some attendees to talk in Hindi, but sadly we have a lot of international audience also, and it is good to keep one medium of communication. So the names magnetis polus articus, magnetis polus australis, and magnetis polyumbo, which we discussed yesterday, will seem very much alien, and it will be difficult to grasp for the first time reader. To simply explain, magnetis polyumbo is the entire magnet which was proved by keeping on different areas of the body, different sections of the body, and what sensations were observed. Magnetis polus articus, we know the Arctic pole, the North Pole. So this is the magnetis polus articus. And the South Pole is Australia is in the south, so magnetis polus australis is the name. So the north pole of the magnet is proved and the south pole of the magnet is proved. Now if you read the remedies individually, there will be a lot of things which will confuse you. So when you read the remedies in a string, like the entire magnet, the magnetis polyumbo, magnetis polus articus and australis, all these three remedies, when you learn in a linear fashion, it will help you understand the differences and the commonality. The commonality, the first thing which we should know, and the commonality is that there will be vague sensations, there will be vague presentations in the physical sensations of the patient. It can be in vertigo, it can be in the different types of pains. It will be in different physical generals of the patient: thirst, appetite, taste, stool, sleep, male sexual, female sexual organs, and uh, the differences is that they will have different sensations at different times. So Alan keynotes is the best place because it's the three remedies, all the entire magnet, north pole, south pole, have been mentioned in numerous pages, like 3 to 4, sometimes 6, 7 pages. So it is well worth to give attention to these remedies, and also keep in mind the polygress remedies, and then be ready for when you need to prescribe these remedies as a, prescription, or the other remedies as a prescription. So we'll go through the north pole of the magnet, which is magnetis polus articus for the moment. So magnetis polus articus, let us study this remedy. In the mind, Alan mentions that there is kind of a weary feeling in the patient. There is he's out of humor, he does not know how to talk, what to talk. There is lot of sadness, especially in the evening. And there will be also the symptom which we saw in magnetis polyambo, which is that when he is attending to his business, he talks to himself. He makes mistakes in writing, and he is hasty, bold, quick, and firm. All these symptoms are very much common, very much broad. It may not help to prescribe. And I have always been telling in all the sessions that if you wish to prescribe a remedy, think about any strong physical general at the time of prescription, or think about any strong particular symptom. There will be thematic prescriptions also. There will be prescriptions on the basis of mind also, which you will be given, which you will be giving. But the chances for success will only be there if that pattern is seen in the patient, which you consider from the mind aspect for the patient. So more about this you will get to know in all the different videos that I'll be sharing. But what is there for us to know to prescribe is that there will be much relevance of physical generals and physical particulars as a prescriptive pointer, rather than something that is dependent on interpretation, which is the mind symptoms. And that's where when we study the remedies magnetis, polus, articus, and australis, we see that the physical sensations are very much pronounced on the different parts of the body. For example, in the north pole of the magnet, which is magnetis, polus, articus, we see that everywhere the different sensations are as if it is pressed from outside towards inside. If you remember this, your job to prescribe the remedy magnetis, polus, articus becomes easier. There is a vertigo feeling which he feels that he falls in any direction. There is dullness of the head, desire for open air, very common and broad symptoms. But the sensation that there is pressed feeling inside from the outside compartment or from the external body surface is very strong. You will see that in headache, you will see that in various parts of the headache which is happening. And going forward, we have in the eye symptoms, again there is drawing like pains, which is pulling like. From drawing pains, what you should remember is a very beautiful polycrest remedy, which is causticum. Causticum is a remedy which has all sorts of drawing pains in legs, abdomen, arms, or different parts of the body. So by the drawing pains, by the explanation of the pains from the patient, you should be able to understand that drawing pains are very characteristic for this patient, and this he may require causticum, or he may require some other remedy also from the plant kingdom if the sensation is too strong. For magnetis, polus, articus, the pressed feeling, it is like a pressure like feeling from the external from outside the body towards the inside, and that feeling is also there in the eyes. You see there is drawing in the eyelids with lacrimation. This goes with the other sensations in the head which we saw, that is pressed, as if it is pressed from within or from outside towards inside. And there are various sensations of illusions which we saw in magnetis polyambo, which is the main magnet, and you will see it in the north pole of the magnet as well. Next you have is in the nose, again as we saw in the main magnet, in the north pole north pole magnet proving, we see again here there is illusions of smell, there is bleeding or redness of the tip of the nose, etc., etc., and there is a kind of a vague sensations in different parts of the face or ears or eyes. Again in the face you will see that there is drawing like pain, drawing in the left cheek. So when you see a common symptom running through the thread, running throughout the entire patient from top to bottom, that is where you should think that this patient needs to be thought about differently. At that time, all your concepts about mind, about theme of the patient, about the physical generals, should be kept aside, and you should just focus on the sensation that is going to liberate the patient from his agony. And once you realize this, you are going to transcend your practice by considering something that is exceptional, out of the box thinking, rather than thinking always about the run of the mill remedies or common remedies which you have always thought of. So again in the jaws, teeth, face, everywhere that you see is there is a sensation of drawing pains or something that is pulling or pushing. So pull and push you will always see in all the magnets. Wherever there has been a proving, there is a pulling or pushing sensation. This goes in sync with what the magnet actually does. And once you understand this concept, I spoke about various plant remedies, various animal remedies, various other concepts from the Allen's keynotes. And once you understand the doctrine of signature, your job to prescribe becomes very easy. And that is what the first thing that you should do is that when you understand the new remedies, especially the magnet, you will be in a dilemma firstly about the name of the remedy. For a few months you will not be able to grasp the name. Next is that it has so many symptoms, it is kind of a commonality. Pick out what is commonly mentioned, what is mentioned as a common thread across all these symptoms that is mentioned about the remedy in the entire materia medica. And next what you see is what is peculiar for this remedy which the other remedies do not have. That's where you will be able to come out of the box from the routine prescriptions and think about this remedy. So magnetis polus articus will be a remedy which will have lot of pushing sensations, pressing sensations, something that is pressed from outside towards the internal parts. You will see that in the temples, you will see that in the toothache, especially you see that there is in toothache, there is burning in the cheek and there is drawing in the temples, and burning pain or in the cheeks or in the teeth is very important with or very peculiar with the drawing pains. There may be a peculiar symptom which you will see in Allen's keynotes, which is toothache ceases when walking in the open air and returns in the room. Many times in cases of toothache, we tend to often ignore asking what is it that is disturbing the patient and how does he make himself feel better. The agony of the patient is so bad in expression of the tooth pain that he focuses only on what is bothering him. He may not have observed that he has probably taken a walk or he has lie on that particular side. And if we try to decipher this from the patient, we need to ask those questions, then they will be able to tell you more about it. That's what we do. when you go more deeper into understanding homeopathy and the different remedies, you should be able to ask. And in magnetis polus articus, you will see that there is better by walking in the open air, and gets aggravated when he returns to the room. Next you have is again drawing pain everywhere in the this remedy magnetis polus articus, which is the north pole of the magnet. You will see that there is drawing pain in the hollow of the teeth, and everywhere again in the stomach region, also drawing pain in the stomach extending into the chest. So there is a kind of a mechanism which will mimic the forces of magnet. Okay, and once you understand that doctrine of signature and the patient's expression, you will be able to prescribe this remedy rather than your constitutional medicines which you always think of, or something specific or rare remedy that you will be thinking of. Hahnemann came to these remedies at the end of the organon, or maybe after he had proved 100 remedies or so, and he thought that these remedies can also do a lot of influence on the human body, just like the other remedies from the plant, mineral and the animal kingdom. And that is why, if these remedies were proved by the master, we should take a look at these remedies, find out what are the prescriptive pointers, and think about prescribing. So in the lecture so far in 17 minutes, I have spoken a great deal about magnet, something that probably I never did before. But if you are someone who is joining late, like I see some people, Dr. Thaure Homeopathy Clinic, Shifa Siraj, Gayatri, Rashida Muraf, and Maruf, sorry, Dr. Poonam Homeopathy, and some few people on YouTube also, names I can't see. You all can go back in the beginning of the session, maybe yesterday's previous session also, which is on magnetis polyambut, that is the entire magnet, and go through what interesting symptoms that I shared, and maybe you can get some insights on how you can prescribe this remedy. So in the abdomen also, this remedy will be having similar drawing pains which are in the hypogastric region, or sometimes in the stomach region, which are drawing towards the chest region. And there are some symptoms again in the chest, which is almost like pressure in the region of the heart. When patient says these symptoms that there is pressure in the heart, your mind should, after the case is done, your mind should run through the different polycrest remedies. Of course, Kilcaria, phosphorus, sapia are the other remedies, but you should also give a thought to magnetis polus articus, because it is one of the remedies which has this symptom running throughout the entire proving and throughout the entire remedy in different parts of the body. Cramp like sensation in the arm, violent coldness in the arms over which the magnet had been moved. So those parts will become either cold, or there will be some sensation that something is pushing within from outside. Next you have is tearing pressure in the outside of the knees towards the outer ankle, in the extremities, sore pressure in the corns. So everywhere you will have the pressure like sensation in different parts of the body, which is pressing from outside towards the inside, and that is what should give you a general idea of the remedy's prescription. And what is interesting is that there is a peculiar symptom that as soon as the magnet was touched to the tip of the tongue, there was kind of a shuddering all over the body at the moment the magnet was, north pole was touched to the tip of the tongue. And again in the general symptoms, we see that tremors of a particular part as soon as they were touched by magnet. Faintness and bruised sensation, painful sensation in the limbs, which became worse in the open air. So that's about magnetis polus articus. You can think of it when the patient is complaining of vague sensations, vague expressions, and there is pushing inwards pains, something which is coming from out and pushing towards inside. This is the general idea. Going to the next remedy, which is magnetis polus australis. again an alien name that you will come across. Some people take time to grasp these new names, but it's just nothing but to understand that Australia is in the South Pole. Towards the South Pole, the name actually resonates with the place, which is magnetis polus australis. Now, in this remedy, there is again a bit of a changed nature, which is cheerfulness is very less, low spirited in all the magnet remedies. On a couple of magnet remedies which we are taking, both the remedies were not so lively, they were dull, kind of a depressed personality, want of disposition to work, always angry, wants to be alone, company is disagreeable. You will see in magnetis polus australis. Violent anger, excited by slight cause, and becomes hurried and uses violent language. That's where you will see magnetis polus australis. Unsteadiness of the mind, he is unable to fix his mind on certain ideas, and vertigo is there, like we saw in the main proving of the whole magnet and the north pole of the magnet. And you will see in the south pole of the magnet also, which is magnetis polus australis, that there is this kind of a staggering feeling, especially when he is sitting down in the sitting position. I had cured one case based upon this indication. So where will you prescribe magnetis polus australis? We saw in magnetis polus articus, which is the north pole. The previous remedy we saw, everywhere there will be pressing pain which is pushed inside from the external forces. Exactly different thing we will see in magnetis polus australis, which is the south pole. You will see that there is drawing and tearing pain in the left brain, and the headache is there in the occiput, most violent in the room but disappearing in the open air, spasmodic constrictive headache, and then there is dimness of the sight, some illusions of sight which we saw in all the magnets, inflammation of the outer ear, he grooves to that portion of the ear, he will have that kind of itching, again burning in the pharynx with upward sensation. So in this remedy what we come across is, one is that there is upward sensation, next is that there is flatulence at night. In magnetis polus articus, which is the north pole, we see that the remedy had flatulence colic in the morning. The south pole of the magnet has flatulent colic at night, and most of its gastric symptoms are aggravated at night only, and there is again a drawing kind of pain, but everything that happens in the night time. There is inclination to vomit in the morning after waking, and this is the only differentiating symptom. Otherwise all the symptoms are mostly in the night, and there is kind of an intolerance to milk, which is especially in the early morning. He will be able to take milk in the afternoon or evening, but not able to take in the morning. This is one of the very peculiar symptoms. I also cure one of the symptoms based upon this. Now you go further when you read Allen's keynotes. Male sexual system is one of the areas which has been affected by the south pole of the magnet. If you think this from the perspective of the human body, the magnets, you will see that the north pole has been not so affected the those areas, but the south pole is affecting more or less those areas. Hahnemann has cured a case of nocturnal emission in a person who was affected with hemiplegia, and there is drawing up feeling. So in north pole of the magnet there was pressing sensation from outside, and in the south pole of the magnet there is kind of a force which is pulling some sort of pain or drawing something from below upwards. Once you understand that, your job to prescribe this remedy becomes very easier. And in female reproductive system, what is mentioned by Helen is that when the woman held south pole of the magnet and at the same time she touched the middle of the bar, the south pole appeared to excite hemorrhage, whereas the north had done the opposite symptom. So if it strikes you and if it develops If the patient develops these type of symptoms, drawing upward pains with hemorrhage, you can think of magnetis polus australis. And what you will have is that there is crawling in the left arm, especially when the patient is moving or resting somewhere, as if there is snakes. We have the same sensation in coccus cacti, cocaine, and the other few of the remedies. And there is jerking of the feeling by least touching of the magnet, or it can be that there is jerking of the hands or the legs when anyone else touches. So in short, to summarize, where will you prescribe magnetis polus australis? There is drawing pain which is coming upwards. Magnetis polus articus you will prescribe when there is pressing sensation from outwards, and there is lightness of whole body in the south pole, which is australis, magnetis polus australis, whereas there was not such feeling in the north pole of the magnet. Let me know in the comments. Few people have joined very much late. Dr. Rahul Raj, Dr. Amar, Dr. Anu Verma, and Homeo Medic, and a few people on YouTube. If this has helped you to understand these intriguing remedies, let me know in the comments. And if you wish to know about something about my courses or something that those activities which we have done, everything is there in the posts mentioned, contact number and email address. You can get access to the recordings, case taking, rubric workshop, it can be kingdom workshop, fever workshop, renal calculi workshop, by contacting my team. And that's all for the moment right now.